Well, I'm excited to share another present that I bought. Now we come to the Dilators. This is from Intimate Rose, but there are many different companies that make dilators, and you can buy them from Amazon or other websites. And your gynecologist or your physiotherapist may have said to buy some dilators to help you with a tight vaginal opening, especially if you have something called vaginismus. Then you may want to use a tool, which this is, to help with the tension in your pelvic floor. So let's have a look at what this is. This is a medium size. I think it's the best all-arounder. There are lots of different sizes that you can get. This is gonna be loud on camera. There we go. Sorry. So here we go. That's what it looks like inside. For those that have a very, very tight pelvic floor, you're not going to start probably with medium. You're going to need a smaller dilator to start with. But I thought we'd go with this one because this really is the one that most people will buy. This is the smallest one that I have in this box, and it's made of silicone, so it has some flexibility to it, and it's nice and smooth, so it's fairly comfortable. You don't want to use a oil-based lubricant. You want to make sure that it's water-based so that you don't degrade the silicone, and you can just wash it with some soap and water, so it's nice and easy. Ideally, you're using your dilators daily, and some websites and some instructions will say to have them in you for 20 to 25 minutes, and you're not supposed to do anything like read a book or watch TV. You're supposed to lay there and relax. I have been using these, suggesting these for clients, dilators in general, for many, many years, and I think that as long as it's not too scary a movie, that you're getting tight in the pelvic floor, or your book's not too racy, you can read a book. Just lay there, be calm, read a book, maybe watch some television, because 20-25 minutes is quite a long time to have these in you. And when we're busy women and we have things to do, sometimes we don't want to do that. I do not want that to be a deterrent. I would rather you have them, utilize them. And if you are just looking on your phone or reading a book or watching some TV, that's better than thinking, oh, I don't have the time to lay there for 25 minutes. Also, the time, I find that it's better to do the dilators consistently than do them every few days because you don't have 25 minutes. I usually tell my clients 10 to 15 minutes. 15 minutes is great if you can leave your dilator in. So if you're very tight, you're going to need slightly smaller size. So you get the small box, small to medium sizes. And this medium size goes into a size like this. And what you'll be doing is it has a stopper, so you can't go in too deeply. Some of my clients have a bit of vaginal vault prolapse, so they found uncomfortable to push this in too deeply. But what this will do is, as you go, you may start with a smaller size, and you gently place this into the vagina, and it's going to gently stretch out the tissues. You do not go for the biggest one and force it in. You just use a smaller one so that it's comfortable, because you're going to be laying there for a little while. So use the smaller one, allow your tissues to accommodate for that size, and then slowly progress to a larger size. How quickly will we progress? I often find that when we start with a smaller size, our body gets used to the sensation. It doesn't want to push the dilator out. And after a week or two, you find that you're ready to go up to the next size. So you can use the next size, and then maybe after, depends, 2, 3, 4 weeks, you can use again the next size up. So make sure you do use some lubricant, because it can make it more comfortable for you. And it's better if you don't have time for 20 minutes, it's better if you can use it consistently, even if it's just 5 minutes, and use them for the 5 minutes to allow a little bit of that stretch. Myofascial tissue, so muscle and fascia, does start to stretch out with shorter periods of time, so 60 to 120 seconds or so. But to get the best effect, we do want them sitting into the vagina a little bit longer. And again, don't push or create any pain. If you find that when you're using the dilator that it's actually creating a burning pain that does not go away within 1 to 2 minutes, then you might not be ready for that size or for this tool. You might have to go back to your doctor to get some medical intervention, go back to a pelvic floor therapist, and review other strategies that you can do until you're ready for this. So if it's increasing your pain, stop using it. Don't use it if it's making things worse. Sometimes after a few hours, it actually will have a big flare. Let your therapist know about that too. Sometimes it's just the first time as your pelvic floor maybe adjusts a little bit to that sensation, but if it happens consistently, you need to stop. So let the pelvic floor therapist and discuss the symptoms, and they can direct you to the best action. So yeah, that's your, like I said, you don't have to buy this brand. There's different brands that you can buy. Just make sure that they're smooth and they're easy to insert, and that you don't push into the larger sizes until you're ready, so that you can gently start increasing the size of the vaginal entrance. Now, another thing you can do is, like a pelvic wand, which I have in a different video, with the pelvic wand we can manipulate the wand and stretch out the tissue. These aren't the best for going into the deeper areas of the pelvic floor, because as you go in, it pushes on the vaginal entrance a lot. So as you go in and you're trying to get into those deeper muscles, it pushes into the opening of the vagina and can hurt the opening a little bit. But having said that, a lot of clients, when they have a tight vaginal opening, really find useful is when they go into the vagina, they can gently manipulate the dilator and gently press a little bit more to get a bit of a stretch going one way and then the other. You never press up towards your bladder, nor do you push down towards the rectum. So don't go to the top and don't go to your back and bottom. You want to do around the sides. So the dilators can be used a little bit like a pelvic wand, but they're not the best because the shape is not correct. So you don't get that nice curve that can access those deeper muscles. So I hope that's helpful. Do try to use them daily. Make it easy for you to put them into your day-to-day practice by setting things up where you are able to lay down and be in a comfortable position, or be reclined in that position for, like I said, anywhere from 10 to 15 minutes is great. Some people say that 20-25 minutes, but around the 15-minute mark is pretty darn good. Okay.